The laparoscopic gastric bypass is the commonest weight loss operation in the United States, but is not so common here in Australia. It has a long track record. It was first performed back in 1967 as an open operation, but in the last 5 years has been performed with keyhole or laparoscopic surgery. It is the most difficult and demanding of the three operations that I perform. It has been shown to have particular benefits for type 2 or non-insulin dependent diabetics. The advantage of the laparoscopic gastric bypass for diabetics is that they gain improvement in their diabetic control before they lose weight. With all of the weight loss operations, if diabetics lose weight, the diabetes will get better. With the laparoscopic bypass, the diabetic control comes before that weight loss. With all of the weight loss operations, if a diabetic loses weight, the diabetic control will improve. With the laparoscopic gastric bypass, you gain improvement in your diabetic control before you lose the weight. With the laparoscopic gastric bypass, we create a small pouch from the top part of your stomach, which is then connected directly to the small bowel. This means that the food that you eat fills up the pouch, and you feel full, and then it slowly passes down into the small bowel, where it then meets the digestive juices further down. The stomach is left in place, as it is important for absorption of iron and calcium, and also B12, which can lead to anemia if not corrected. Just stop that, can that last. The rest of the stomach is left in place because it's important for the absorption of iron and calcium, and also it produces a hormone which is important for the absorption of vitamin B12. Obviously, your anatomy is changed, and it is not possible to access your stomach with a telescope may have been done previously. This means it's important for us to check out your stomach before the surgery to make sure there are no abnormalities, and you have to be aware that should you develop some complications such as gallstones, that instead of having an endoscopic procedure with a telescope passed through your mouth, you would have to have an operation instead. Typically, patients who have had a gastric bypass surgery have very little appetite for the first 5 months. They have rapid weight loss during this period. Then, at around about 5 months, their appetite returns, and therefore it's important that in this first 5-month period you establish your good eating and exercising habits. One side effect of a gastric bypass is if you eat a large amount of processed sugar, it very rapidly gets into the gut through the small pouch, and two things can happen. First of all, the body senses the sugar load and can produce lots of insulin, and then you can have hypo-type symptoms, and in addition the body secretes lots of digestive juices to break down the sugar, and this can lead to bloating and diarrhea. This is called dumping syndrome, and some people feel that this is a good thing to happen, as it reminds you not to eat too much processed sugar. I would prefer that you try and avoid suffering from dumping syndrome and stick to the good healthy diet recommended by my dietitians. The laparoscopic gastric bypass involves a 2 to 3 day stay in hospital. It does have the highest mortality risk of the 3 operations, of about 1 in 500, and also has an increased risk of complications such as a leak, as we have to create 2 new joins between the stomach remnant and the gut. In terms of weight loss, the laparoscopic gastric bypass produces rapid weight loss, and you can expect 55 to 65% excess weight loss within 12 months. And we know from the studies in the United States that this is maintained over the long term.